The treatment options are quite variable. For most children with a neuromuscular curve, maintaining a sitting position becomes increasingly difficult as their curve worsens. They usually don't have the appropriate torso control. And there are several ways to combat that in the short run. One is various kinds of adaptive seating equipment, and another is a body brace or TLSO or body jacket. And I think that the way we view body jackets and progressive deformity is that the body jacket is very much a viable option for helping you sit. It's a functional piece of equipment that can help you sit. It possibly, and again it depends on the circumstance, it possibly slows down the worsening of the curvature. It probably doesn't ever prevent the curvature from becoming a problem in the long run, but it can slow it down and make it become a problem at an older age in growth rather than an early age in growth. So body jackets in one form or the other are a mainstay of treatment. We emphasize that they should be used for function. So if they're helping with your function, great, use them. If they help you sit up, great. If they're just getting in the way and making it harder to breathe and giving you temperature regulation problems and giving you skin problems, then they're not functionally terribly helpful, and don't use them. So body braces in one form or another are one option. If you stand back and look at surgery, surgery does two things. It partially straightens the spine, but more importantly, it stabilizes the spine permanently so that it won't then collapse over time. And surgery is what we've been talking about. Is certainly the final option for many children with severe neuromuscular problems or complex problems. Some children get into trouble with a bad curvature well in advance of adolescence. So if you're a 5, 6, 7-year-old and you have a very large curve that can't be supported with a body brace or that is interfering with sitting, or as we talked, if your spine's beginning to poke out through the skin, then you have a problem that is appropriate for surgery. But if you do the traditional spinal straightening with instrumentation and spinal fusion, you then arrest the growth of the spine at that level. That's okay if you're 12 or 13 or even 10 or 11, but it's not okay at a younger age. So some younger children are treated with expandable rods or expandable vector devices or magnetic rods or various things that grow with the patient and keep the spine temporarily straight while still allowing the patient to grow. For instance, the spinal muscular atrophy patients, there's been a huge improvement in our ability to keep them straight and keep them growing while not having to do repetitive operations. So expandable rods in one form or another is one option. And then the final option, of course, is what we've been talking about here, a spinal instrumentation and fusion.